As you turn 65 and over, it is absolutely critical that you understand your health insurance options so that you don't make the same $45,000 mistake as Debbie did. So in this video, I want to walk through how do you think about health insurance once you're 65 or over, and how you decide what makes the most sense for you to, again, avoid these costly mistakes like Debbie and so many others do. I'm Emily with the Medicare Coach, an independent Medicare consultant who's helped over 10,000 people, including my parents, easily make their right Medicare decision to both protect their retirement savings, but also have really good health insurance. I will share some extra shortcuts to Medicare down below as well. But in this video, I want to talk about those of you who have multiple accesses to health insurance past 65. And how do you decide what to do with those? Now, this might seem a little silly for one of two reasons. Number one, people assume that you must join Medicare at 65, and that's not always the case. Or number two, people assume that any health insurance will work, they can delay Medicare no matter what. The reality is the truth is somewhere in the middle, and I want to walk through, depending on what your situation is, how do you decide what to consider and what's ultimately best for you to have good health coverage, to avoid surprise massive costs, and to also be able to continue to see your doctor. So let's talk about that in this video. So number one, I want to be clear that Medicare rules say by the time you're 65, you must either be on Medicare or on an employer health insurance plan that meets Medicare rules. And if you don't do one of those two things, you will have lifetime penalties and large expenses like Debbie did. So when I hear people ask this question, I want to kind of break through or walk through all the different steps based on what other health insurance plan you might have, right? As more people are working past 65 or have retiree plans or other things, there's a lot more to consider than there's been in the past. So what I see the most right now is active employer plans. So we're going to go through employer plans, we'll go through retiree plans, we'll go through marketplace, we'll go through COBRA, we'll go through private plans, Medicare plans, all of those things. Let's kind of hop up or start with employer plans, okay? So when it comes to Medicare and employer plans, I always ask ourselves a couple questions. Number one, does your employer plan meet Medicare rules? Having an employer plan that does meet Medicare rules is usually the only way to fully delay Medicare with no penalties. So in order for your employer to meet these rules, number one, it must have 20 employees or more. If you are disabled, there's a different requirement, but it's usually 20 employees or more. Number two, it must not require you to join any part of Medicare Part A or B. If your employer plan says, well, that's great, Jane, you can be on our employer plan, but you must have Medicare Part A or B, then you have to join Medicare Part A or B. Number three is, does the prescription coverage provided by the employer, is it deemed creditable? Now, creditable means the plan on average covers medications as well as or better than Medicare. The key here is that your company is legally required to confirm this for you every single year. So ask for a pamphlet to clarify if it meets Medicare rules or not. If you're not sure if it does, ask your HR or your benefit team to confirm those for you. So if your employer plan meets all of those requirements, you could technically delay Medicare past 65 with no penalties. But there's a few things to think about in addition to that. Just because you can delay your employer health insurance, you need to ask yourself, should I? And there's two other factors to consider what you should do. Number one is coverage and costs, right? If you have an employer plan that has a high deductible, has a high out-of-pocket, and you're always hitting those, or your provider's not covering certain things like certain procedures or surgeries or providers, things like that, Medicare could be a better option for your overall coverage as well as costs. So when we have clients who have both employer plans, whether it's theirs or their spouses, as well as Medicare options, we want to compare the two side by side, including both the costs and the coverage, the medication copays, all those things. We tend to find that people who have high medical costs are usually better off on Medicare because the right Medicare combination can be less expensive than your employer plan. But again, we want to look at the numbers to determine what makes the most sense for you. Okay. We will also consider, though, family members on your employer plan. So I have a client, Jane. Jane's working, but Jane has a son on her employer plan as well as a husband. And so she's trying to decide, do I go on Medicare or do I keep my employer plan? Well, because her husband and son are not yet Medicare eligible, and because of their alternative costs for health insurance, she is better off delaying Medicare, staying fully on her employer plan, paying a little bit more for her health insurance, but on a family basis, it actually costs them less overall. So again, when we have clients who have other people on their employer plan, we have to at least think about you all in the big picture, because taking Jane off of the employer plan could impact her husband as well as her son. So again, on employer plans, ask yourself, does it meet Medicare rules? What is the cost and coverage? And do you have family members to consider as you're making your big Medicare decision? Okay. Now, the next thing we see most commonly is retiree plans. So if you have come from any sort of company and sort of government entity, any sort of employer who's offering you a retiree plan, it's important for us to understand what are the rules. Number one, I would say 98% of all retiree plans will require you to have both Medicare Part A and Medicare Part B once you are 65. Okay, so we want to see what are the Medicare requirements for you as an individual. If they require you to Medicare Part A and B, you should probably join that Medicare Part A and B as well. Now, the next question we have is, okay, if the plan does also require Medicare Part A and B, what does that retiree plan cost and how much coverage will it provide for you? For example, I had a client the other day who was paying $500 a month for her employer health insurance for her retiree plan. And I said, okay, so what does that actually provide you? And it provided her some prescription drug coverage. And based on kind of what I saw her meds as, and what I saw what Medicare will cost you, I said, you know what, your retiree plan actually has no benefit at all. It costs you a lot of money with no great coverage. You are better off dropping your retiree plan and fully joining Medicare. Now, that's not always the case. Some of our clients will say TRICARE for life. TRICARE is a great plan. Certain federal employee health benefits can be good as well. But all other plans, we want to understand what are the pros and cons between Medicare and the retiree plan, and does it make sense? Oftentimes, the retiree health insurance plan does not make sense, as it can be quite expensive for the coverage they provide. So think about, just because you have a retiree plan, ask yourself, does this make the most sense for you? Are you better off with other options? Now, we also want to know, do you have family members on your retiree plan? I had a client who retired from a large oil and gas company. He had a retiree plan that was actually not very good, but he had a younger spouse. And if he left the retiree plan, that she was going to lose her coverage as well. So we want to ask ourselves, if you keep a retiree plan, how does this plan work work with your other family members? I've also seen a university who actually cancels the entire plan once the employee passes away. We had a client who we helped. She was a widow, and she did not realize at the moment that her husband passed away from his university retiree plan, she fully lost her health insurance. And so there are things to look at as you're thinking about retiree plans as well, because there can be some fine print that is important to be aware of earlier rather than later. Okay. Now, we also see a lot of marketplace plans. People who are coming from marketplace plan who really want to keep that marketplace plan. But here's the thing. Number one, marketplace plans do not meet Medicare rules when you are eligible for Medicare. And number two, when it comes to the costs are usually a lot higher on the marketplace plan than on, say, Medicare. Now, you might say to me, but Emily, I don't pay anything for my marketplace plan, or I pay under $200 a month for your marketplace plan. If that's the case, if your marketplace plan is quite inexpensive, it's likely because you have a subsidy. And those subsidies almost always expire once you turn 65. So again, just because you have a cheap marketplace plan in the past, it doesn't mean that low cost will still apply once you turn 65. So most of you will join Medicare. Now, when we have couples on the marketplace plan, it is usually quite simple enough that one of the couples who's 65 or ready for Medicare can leave that plan, and usually the other person from the family member can stay on that stay in that marketplace plan. So it's not abnormal or hard to have one of you leave the marketplace plan while the other one stays on there as well. But again, most of you, if you have a marketplace plan, you will be joining Medicare at 65. Now, what about other private or also Medishare or Christian health share plans? Those plans also do not meet Medicare rules. Same with the marketplace plans, they're also quite expensive, so Medicare is almost always cheaper for you. And also, like the marketplace plan, it is very easy for the 65-year-old person or above to easily leave that marketplace plan, that private plan, that Medicare plan, and leave the rest of the family on that plan. So it's not abnormal for one of you to come off of that private plan, that Medicare plan, and everyone else stays there. Okay, now finally, COBRA. We are seeing more people get laid off, unfortunately, these days. So it's important to know that COBRA does not meet Medicare rules. Now, this boils my blood because HR almost every time will say, well, we're going to let you go, but don't worry, this health insurance is the exact same as your past health insurance. There's no difference to you. That's not true. That's not true once you are 65 years and eligible for Medicare. If you or a loved one have COBRA, please know that's a massive red flag as you are 65 or over because it absolutely does not make sense, okay? The costs are quite high. The coverage is basically nothing. The woman who lost that $45,000, she had COBRA. And she did all of this research to understand, does she need Medicare, does she not? And based on what she read, she did not need Medicare. But that's not the case. She kind of got lost in between rules, and she now has $45,000 of medical bills. Because despite her paying $1,000 a month for COBRA, COBRA is secondary to Medicare once you are 65. She did not have Medicare Part B. And so COBRA would not pay the 80% of the costs that Medicare Part B would have covered. So that $45,000 she's stuck with because she canceled the plan that would have cost her under $200 a month. So again, COBRA does not meet Medicare rules. Now, we will have some clients who will have them keep COBRA, but also join Medicare simply to cover their family members. Now, it depends on the cost and the details of your family members, but COBRA could make sense to keep in addition to Medicare, but there's some other factors to consider when it comes to deciding, are you better off keeping your COBRA or just fully joining Medicare? So my point is this. Medicare and health insurance is getting more complicated every single day. Medicare is not always black and white, so especially if you have other health insurance options, you need to look at the details of those plans to decide which one makes the most sense for you, both to avoid penalties, to lower your costs, and have the best health insurance possible. So make sure you follow along for more inside tips, and here's to help you easily make your right Medicare decision.